Welcome back to Scissors and Scrubs. I'm Nicole.
I'm Laura.
And it is summertime. I love it.
So nice.
It's making me very happy.
Mm-hmm.
Laura, what are we doing this summer?
We're going to Spain.
Yes, we are. We're traveling. And as does everybody else, it's summer vacation. People are traveling abroad.
Mm-hmm.
And though many trips are very uneventful, you go, you have a great time, you put your shit on Facebook and Instagram, and you come home, there are some times when it can be very bad. So, I am going to talk about, I had other stories, but so this girl's story is crazy. Not crazy, but interesting.
Not good.
And then I had like all these other stories, and they were all exactly the same. Either they got the GI bug or they ate something, they gave them the shits, and they were sick on a bus. Or so I was like, I'm not reading those. So I only have the one story.
Okay.
But it's something. Okay. So we're going to talk about Jordan. Jordan's from Australia.
Oh.
That was the worst accent ever, but that's where she's from. But she is going to go to Prague in the Czech Republic.
Oh.
All right. She's living in a hostel, and she loves Prague so much. It's the best place in the whole world that she decides that she's going to work at the hostel, and she gets to stay in Prague for free because she's living and working for the hostel. Okay. So she is out with friends one night because one of them is now moving on to a different country, and they're all partying, and she's hanging out, and she's having a few drinks, having a great time. And now she's familiar with this hostel. So this is why I don't understand what happens. All right. So she wants to go out for a smoke in her usual spot. Her usual spot is on a roof that's about 3 feet by 8 feet, and it's like a balcony. So she steps out of a window thinking she's getting onto the balcony, and she falls 4 stories.
Oh.
There was nothing there. He mistook the window. I don't know what happened.
Yeah, she's in the wrong
if
room.
she's lived here, I don't know, but she and you put your whole weight on. Like you're going out a window, so you've got like you
one leg at a time.
Aren't you feeling for that?
Right.
Okay, whatever. I don't know what happened, but she went 4 stories down.
Yikes.
In Prague.
Yikes.
She broke her pelvis on both sides, both elbows, ribs, ruptured her spleen. She got deflated lungs, major concussion, and internal bleeding. She calls her parents. Her mother's like, which is what I would do as well. Her mother's on the next flight from Australia to Prague. She phones the travel insurance company and the Australian embassy, which have been contacting this girl, which I would never think to call the embassy. Smart. The insurance adjuster arrives before the mother does. Oh. And they start asking a ton of questions to this girl who is highly drugged because she's in agonizing pain.
Yeah, because
she's in an ICU. Yeah. So she's 5 days in the ICU when the travel insurance is canceled. And now she can't get her elbows fixed because they've canceled everything. They said she was canceled because she was drinking and had tried to sit on the roof, which is deemed a highly risk activity. Her mom had to max out multiple credit cards to get the operations. And then her spleen ruptures. Now she has to go in for emergency surgery for her spleen.
Oh, my goodness.
She's in touch with the embassy and asked, can we have some more support? And they were like, yeah, we can't because it has to be a natural disaster for you to have more support. Like they can't fly her out or anything because it was of her own doing. So she wanted to get medevaced home, but that would have been over $100,000.
Oh, yeah.
So she had to be strong enough to sit on a flight. So they would sit her up for weeks. And she couldn't move.
With a broken pelvis.
Yeah. They would just sit her up to try to get her to tolerate the flight because Prague to Australia is like 24 hours. Yeah. 5 weeks after she got back to Australia.
She sat on a plane 5 weeks after that.
Yeah. Oof. Yep. They just charged her because she was healthy enough to go home and she had to take the flight home.
Oh, my goodness.
I think it would have been cheaper to book an entire row for her to lay down on than it would have been to medevaced her from Prague. So that was the only story I came up with. And that was the most details I could get for you.
Okay.
And I did look, but it's just people's stories traveling. Like, I'm sure there are other horror stories. Like, we just had friends who they were doing a, not a medical mission, but kind of like a medical mission. And they went to Africa. And they were in a very dangerous part of Africa. And one of them had evacuation insurance. Like, if the political overthrow came in, they would come in and get them out.
Right.
Like, it never would have occurred to me to get something like that. Right. So clue us in.
Okay. I got this from John Hopkins, the CDC, and travel.state.gov. So like you were saying, you get sick You get in, even if you just have the bug and you have to go to the hospital.
Because your insurance, I don't think covers, right?
Right. So you need to, the safest thing to do is be prepared before you ever leave on your trip.
I'll tell you, this opened my eyes before we leave.
So check your insurance coverage to see whether or not you are covered before you leave. Most insurance, including Medicare, do not cover medical evacuations back to the U.S. So if you are in this horrific accident, you need to get back home to get treatment. Because, I mean, plus you could be in a place that can't even treat what you have. It is out of pocket, and it is hundreds of thousands of dollars. If your insurance doesn't cover out-of-country care, you can acquire traveler's insurance, which is like a short-term health insurance policy. Because not only does it not usually cover evacuation, it also does not usually cover medical care wherever you are.
Surgeries or wherever you are.
Take your health insurance ID card and claim form with you on your trip. Make sure you have all of your information. Medicare does not provide coverage for hospital or medical costs outside of the U.S., so older adults may want to contact AARP for information about
get on that.
foreign medical care coverage with Medicare supplement plans. Especially people who are ill, have health problems.
Cruises, I mean, we talked about this on one of our cruise episodes about people dying on cruises, but these people are ancient that go on these cruises because they're easy.
Right.
And they can still travel. It's going to be me. I can still travel, but I'm on a cruise. And they use them like nursing homes.
But you need to have a backup plan. Complete the information page on the inside of your passport. Name, address, and phone number of someone to contact in case of an emergency. This will facilitate identification if you're in an accident. Like she could have fallen off of that
and been unconscious
and not been and then people are looking for it's days before they find someone for you. So make sure you have all that information so someone can get you help. If you have pre-existing medical conditions, get a letter from your doctor describing the condition in depth, because you could be going somewhere where they don't know what this is.
Yes.
And any prescription...
don't think of that.
Yep. And any prescription medications you take, bring that and a copy of all written prescriptions with you, including the generic names of the meds, because you could take Advil here, but it's ibuprofen there, and they don't know that it's Advil. I mean, I'm using that. Obviously, they know that. But like, your name of your med here might not be what they call it there, and they might not have a clue that that's what it's called. So you need to know the name of your medication and the generic name of your medication. And make sure you have not only enough medication to last your trip, but extra in case you get stuck there. You lose it. It drops. You need to have extra meds.
One of our friends said he ran out of his blood pressure medication.
Yes.
And they were in Asia.
Yeah.
And he was like, I was panicking.
Yeah.
I'm like cutting my pill in half. And I'm like, oh my God, you do not want to run out of it. And then try finding a pharmacy or something. And like you said.
And you need a prescription. Right. And like you don't have a prescription
and they don't
for
know
over
if
there.
It's the right or the strength. You don't know what you're dealing with getting over there.
Yeah. The numbers are all different. Yep. The units are different. Know your blood type. Some countries do not have accurate or reliable blood screening systems. Have like an emergency card that has your pre-existing conditions, allergies, and blood type on it. Bring all medications you will need with you in clearly labeled original containers. You can't just put them in like a pill box. They have to be in their original containers. Some medications are considered illegal in foreign countries. So you have to have it like, this is a prescription, blah, blah, blah. And even then it can be illegal and they can confiscate it. So you may want to check with the foreign embassy of the country you are traveling to prior to leaving to make sure all your medications are okay to bring. Get a list of English-speaking foreign healthcare providers from the International Association for Medical Assistance to Travelers. That is literally a website you can go to. If you're going to Spain, you can look up healthcare providers that speak English.
Yeah, but what if you're not near any of them?
Right. Like, but at least maybe you could say, here. Or they could call them, maybe. Enroll in STEP, Smart Traveler Enrollment Program. It's a free service of the Bureau of Consular Affairs in the Department of State. It allows you to check for and monitor any travel advisories for your destination.
We should probably do this.
Mm-hmm. It ensures that the U.S. Department of State knows where you are if you encounter serious legal, medical, or financial difficulties while traveling. And in the event of an emergency at home, STEP can also help friends and family find you
Oh, okay.
Like, so for whatever reason, if something happened here and they couldn't get you, your phone, they can help get you. While you are away. So that's all before you go. You need to do all that stuff. While you're away, if you need to be treated while in a foreign country, contact the nearest U.S. embassy or consulate for a list of local healthcare providers and medical facilities. They can help you. They can say, oh, yeah, go to, this place here, blah, blah, blah. It's, we know it. It's good. Yeah. Whatever. They can help find you medical assistance and contact your loved ones if needed. They can also help with the transfer of funds from family in the U.S. to pay healthcare bills abroad, but they cannot pay any of your expenses. Yeah. That is not their job. Yep. It is on you.
Don't ask.
But they can help get funds from your family to you so you can pay, because sometimes they won't let you leave the hospital until you've paid your bill in full.
Oh, yeah.
I think.
What are you going to do, though? Are you going to just leave me in this hospital bed?
Yeah.
I'm going to. What if I can walk out? What are you going to do? Are you going to arrest me?
Probably,
yeah.
There's several ways to find help while you are abroad if you need help. The U.S. Department of State maintains a list of travel, medical, and evacuation insurance providers. So they're like vetted providers. The International Society of Travel Medicine maintains a directory of healthcare providers with expertise in travel medicine in more than 80 countries. So you can always go on that website. The International Association for Medical Assistance to Travelers maintains a network of physicians, hospitals, and clinics that have agreed to provide care to members of that association. Travel agencies, hotels, and your credit card companies like Visa, MasterCard, American Express also provide information on local healthcare resources. So if you were, for whatever reason, didn't have access to the internet, but you have your little credit card, you can call the credit card. And
I don't want to pay my bill. Can you tell me?
Right. This is going to get bigger. You're going to have to exceed my balance.
Raise my limit.
Yeah. But they can give you local healthcare information. Several countries or national travel medicine societies have websites related to travel medicine that provide access to clinicians, including Australia. You would go to Travel Medicine Alliance. That's going to give you information for Australians' travel medicine. Canada, you would go to Health Canada. China, the website is International Travel Healthcare Association. Great Britain is National Travel Health Network and Center. And then also the British Global and Travel Association, Health Association. And South Africa has a South African Society of Travel Medicine. And that is how you get information.
Well, now I'm nervous. We should have all this stuff before we decide to leave the country, because it's terrifying.
At least, I always think anytime we're away and we walk, I'm like, oh, there's the U.S. Embassy. Like, I always look for the U.S.
I always tell them, look for the embassy.
So I'm like, at least you can go there and they can help you find somewhere. But if it's an emergency.
But it's the money.
You have to pay.
Yeah.
Yeah.
Unless you have the insurance.
Right.
So when we went to Roatan, we're driving through the town. The guy's like, there's the hospital. And I look over. Oh, my God. It was surrounded by barbed wire. So you can't break into it. And this is like the public hospital. This is where, like, if you live there, locals, you would go if you don't have money. It looked like a cell block from 1920 Devil's Island. Like, it was horrific.
Yeah.
And they said, like, so you could see there were like these little sheds around the island. They were the pharmacies. So if you come in and you need any kind of medication, your family has to go to these sheds and get the medication and pay for it, because the hospitals don't carry it. There were clinics that would look a lot nicer, cash. Yeah. So people who have the money can go to the clinics. And I thought, like, oh, my God.
Yeah.
You would never see this in the United States. No. Even our worst hospitals aren't covered in barbed wire.
Right.
And that's when I, like, decided to climb a tree and jump, like, 15 feet into the water. And Brian had a stroke. He's like, you saw the hospital? You saw what it looks like? What do you want? Do you mind? I'm like, I wasn't thinking. I'm sorry. I'm like.
I am always afraid I'm going to have to go to I used to tell my kids if we left the greater Boston area that they weren't allowed to get sick or hurt. Never mind.
We're in the United States. Yeah. No.
Never mind in a foreign country. I'm like, we're in Maine. You can't get hurt. Like,
Maine could be scary.
If we were 15 miles out of Boston, I'm like, you know that. What can't you do? I can't get hurt and I can't get sick. I'm like, right. Nothing.
Oh my! When I was a kid, I'm like, I think I've told this story. I was like 8, 9. My brother and I all went to see my grandparents, And my brother and I were fooling around, because that's what we do. And I whacked him. And then I jumped off my grandmother's flight of stairs and broke my leg. And they didn't see the break because it's Florida and they are stupid. And they wrap it in an ace bandage and no crutches and just told me not to walk on it. Okay, well, how am I supposed to not walk on it without no crutches? Yeah. What, my mother going to carry me around everywhere? And then we took a train home. And my brother, being my brother, was like, well, you got the bottom bunk on the way down, which had the window. So you have to have the top. I'm like, I have a broken leg. I don't care. You're on the top. So I'm climbing like a cargo net with one leg to get into the top bunk. Thank God I was 8 and still agile. And it was like 2 days we came home. And I think my mother didn't want to sit in the ER because even then it was a nightmare.
Right.
And I was in agony. Oh my God, it was so painful. And then finally we got, and they were like, yeah, it's broken.
Yeah.
She's like, oh my God. Now that she's fighting with the insurance company, you didn't say it was broken. You told me it was a sprain, blah, blah. I don't even know what happened with that, but I can remember her vividly being on the wall phone.
Yes.
Arguing with the insurance company over this. It was a nightmare.
Yeah, it's not, again, that's just hair. And I know it's fine hair. And my son, was deployed and he called and he said, I just realized if something happened to me here, I would have to go to the hospital here. And I'm like, yeah.
Well, don't they have a Navy doctor?
Yeah, but I mean, like if something really bad, and he's like, that would be awful. And I'm like, yes, it would. Yes, it would be terrible. So just make sure nothing bad happens.
I would like to think if it was bad, the Navy would fly you to the closest base.
I would too. But he was just
like to think that.
Can you imagine if I had to go to the hospital here? I'm like, absolutely not. Absolutely don't do it. Don't let anything happen. He's like, yeah, thank you so much for working in the United States and being good at healthcare system and blah, blah, blah.
I can't even imagine going into hospital and not speaking the language.
No, that would be so scary.
And not being able to communicate. Yeah. Like I think of that when we have
I feel
can't speak. And we have we have a interpreting machine. These other countries aren't going to have that.
No.
And so could you imagine not being able to communicate and tell them what's really wrong with you?
That would be hard.
It would be horrifying.
Yep.
It would be horrifying. So this was short but sweet, but this is a little episode on be careful while you're traveling abroad. We're probably I'm going to get some insurance before we go, just in case.
I'm going to look it up.
Yeah. Yeah. In case we're going to the Rock of Gibraltar and we tumble down.
Oh, just leave me. You'll never afford this. You'll never financially recover.
Home.
It's okay. I'll be all right.
So enjoy. Feel free to write, call, email.
Well, don't call.
There's no number to call. Yeah. But just let us know. Give us some episodes for the rest of the summer. We'll love to hear from you. Yeah. All right. We'll talk to you later. Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.